homelessness. Before we get started, I want to provide you with logistical information. Please make sure you get online while the presenters talk so you can access the visual component of this presentation. You should have received an email from me earlier today with instructions. In addition, we will be recording today's webinar. First, click the Ready Talk link, enter your name, email address, and click register, and you will be given access to the meeting. If you have any questions throughout the presentation, please type them in using the chat feature in the lower left-hand screen. We will also open up the line for discussion at the end of the webinar and make sure all questions that are asked are addressed. Finally, the PowerPoint presentation and additional information will be sent out after the webinar today. It's my pleasure to introduce Joe Willard. Joe is the Vice President for Policy at the People's Emergency Center, and he supervises all policy and research there. Most recently, Joe was Associate Manager for Public Policy at the United Way of Southeastern Pennsylvania, and also the Associate Director for the Reinvestment Fund's Regional Workforce Partnership. I have the pleasure of co-chairing the statewide HAPPN group, the Homeless Action in Pennsylvania Provider Network, which works to make sure there's enough resources, both federal and state, for organizations around the state to do the work that you're doing. Joe also co-chairs the Children's Work Group Early Childhood Committee. He's a strong advocate for children and families living in and experiencing homelessness. Joe brought this topic to us at the Housing Alliance, and we're proud to present it today. So it's my pleasure again to introduce Joe, who's going to start us off today. Joe?
Yeah, thanks, Joyce, and thank you for the introduction, and hi, everybody, and welcome to this webinar. Hopefully this will be the first of a series of public announcements, webinars, press releases over the next 6 months. The issue of trying to open up access to Head Start, pre-K counts, and high-quality child care for children who are experiencing homelessness is a real challenge for most providers around the state. So we were really glad that last year Congress did something for homeless children in that they enacted and agreed to a series of changes that affects Head Start and the Child Care Development Fund. There's a lot of tremendous changes that are in there. A lot of them are kind of complex. A lot of them, the local leadership in the continuum of cares, as well as the school districts around Pennsylvania, will need to really consider how to implement the new rules and regulations there. It really needs to encourage a communication between we in the housing system and the education system. There's a lot of instances where we don't always collaborate, and from the housing side, we kind of sometimes stay in our silos and are not really successful reaching out to the education system to really coordinate some services so that our children get served. As most people may know, there's more than 6,000 children under age 5 in Pennsylvania who will spend at least one night in an emergency housing program somewhere in Pennsylvania. And we know that's a conservative number. There's probably double that. Recently, the Pennsylvania Department of Education reported that there were some 26,000 students who experienced homelessness last year. And a lot of people are thinking that's going to increase because the new Head Start and child care regulations will help bridge the relationships between education and the housing system. So those numbers are expected to go up, and that's a good thing because we know children are being served where they weren't being served before. We're really happy to have Tracy Duarte here today to help launch this series. I can tell you that we were working with Ben Loudermilk and Jonathan McVeigh at the Department of Human Services who are going to reach out to the Pennsylvania Department of Education and have a deeper discussion about how to make sure that folks in the housing system understand the changes that are occurring in the education system so that we communicate and ultimately serve our families and our children a lot better. So I'd like to introduce you to Tracy Duarte, who has the lion's share of today's work. She has a terrific PowerPoint and presentation for us to learn about the Head Start changes and how we may be able to work at the local level to make sure our kids are served. Tracy?
Thank you, Joe, very much. Good afternoon, everyone, and thank you so much for joining us this Friday afternoon. As Joe stated, my name is Tracy Duarte, and I serve as the manager of the Pennsylvania Head Start State Collaboration Office. I'm so very excited to have this opportunity this afternoon to speak with all of you, to share some information about Head Start and Early Head Start in Pennsylvania, along with some collaboration suggestions for all of us and some resources. And I certainly hope that this proves to be just the beginning of our work together here in Pennsylvania. A little bit of background on me. I served for 12 years as the Early Head Start Director of a home-based program here in Venango County, which is where I live. I then went on for a period of time to work for 0 to 3, National Center on Infants, Toddlers, and Families. While with them, I served as the infant toddler specialist for the Pennsylvania Training and Technical Assistance System. After that, I did some consulting, not only for 0 to 3, but also individually for programs, working on systems and development. And now this is my 4th year, almost 4th, with the Pennsylvania Head Start State Collaboration Office. So we'll just get started here. So our objectives for today are for me to provide you with all of the requirements pertaining to homeless families that are in the Head Start Performance Standards. You'll see in this PowerPoint that I'm referring very loosely. I'm going to use the term housing community to reflect the network of programs and agencies out there providing services and supports to homeless families. So you'll see, I think I've kind of coined that term for this PowerPoint. I'm not sure if it's a term that you use regularly or not. So the next objective is to review the 3 major recommendations that are set forth in the policy statement on meeting the needs of families with young children experiencing and at risk of homelessness. And third, we will explore ways for the housing community to partner with their local Head Start and Early Head Start programs to better serve homeless families. And finally, we'll review available national and state online resources. All right, to get started then, I'm sorry, I went too far. I just want to tell you a little bit about Head Start. So Head Start is a federally funded program. It's been in existence since 1965, and it's funded through the National Office of Head Start. It is a very unique program in that it is served federal to local. The funding does not pass through state government. It goes directly to the local grantees that provide the services. What we call the regular Head Start program is a program that serves children ages 3 to 5, predominantly in classrooms. However, some Head Start programs also serve via the home-based model. There is Early Head Start, which serves pregnant women and children ages 0 to 3. Many of those Early Head Start programs are home-based model, but there are also plenty of center-based, particularly in the newly funded Early Head Start Child Care Partnerships program, which is another Early Head Start program of a different model, and we'll talk about that a little bit later in the presentation. There are also a couple of other different models, such as combination option models, as well as family child care models, but we're not going to go into much about that today. So in order to be in the Head Start program, you must be income eligible, which means you have to be within 100% of the federal poverty guidelines. And there are just a few exceptions to that, and one of those exceptions is homeless children. So basically, Head Start and Early Head Start are really well known for their vast, comprehensive services that they provide. So on top of a preschool environment or a classroom environment or a home-based environment, they also have these comprehensive services. One is education, and really that means that Head Start programs must have a research-based curriculum, They must have qualified teachers staffing those classrooms. Also, health. There are a lot of health and nutrition requirements in Head Start. Staff must help families stay on track with the EPSDT, or Early Periodic Screening, Diagnostic, and Treatment Schedule, and this includes well child checks and screenings. Staff must assist families see that their children are up to date on the immunization schedule. Children receive oral health preventive checks and follow-ups. Staff has to assist parents in seeing that their children receive those. Staff must not only just provide nutritional meals and snacks at the center, at the Head Start Center, but they must also provide families with educational meals and snacks. I'm sorry, not educational, nutritional meals and snacks in the classrooms, and help them to be sure that they have those as well at home. Programs also provide children with social emotional screening, support, and mental health consultations when necessary. Part of the comprehensive services also includes family partnerships, and Head Starts do this by way of forming a family partnership agreement with families, in which is a place where they state their goals and they track the steps that they're making towards reaching those goals. Head Starts are also required to form community partnerships in their local communities, and those partnerships can be with people like yourselves in the housing community. It can be with other social service providers, health providers, mental health providers, etc. And finally, Head Start has a unique program governance structure, and this governance structure is made up of not just the typical governing board that would govern most nonprofit organizations, but it also has a shared governance with what's called a policy council. And that policy council must be made up of 51% of that council must be parents of enrolled children. So that is a very firm, I believe it sends a very firm message about just what level of parents' involvement there is in a Head Start program, because parents must be involved in all of the things that a governing board would be, and they have to approve program options, changes to the program. They have to improve all of the policies and procedures. So it's a very important piece of the parent involvement in Head Start. Okay. So here's some numbers around Head Start and Early Head Start children and families in Pennsylvania. Each year we serve over 35,000 children. The total families served in this most recent 2016 year, 40,481. Children served per program option. So in federal Head Start, there were 28,483 children last year. In the federal Early Head Start, there were 4,462. The new Early Head Start Child Care Partnership Program served 2,904. And in Pennsylvania, we have an additional funding source that does come from the state, and it is available to any federally funded Head Start program can apply to the state to receive additional supplemental dollars so that they can serve even more children. And in that state-funded supplemental, there were 4,311 children served this past program year. Okay, so according to the 2016 annual program information report, which is something that all programs have to file annually, the total number of families experiencing homelessness that were served by Head Start and Early Head Start last year was 1,915 families, which equals 4.77% of those families. 2,285 children experiencing homelessness were served last year for 5.26%, and the total number of families that were served that were experiencing homelessness that acquired housing during that same enrollment year was 641, which accounts for 33.47%. So we'll talk about the performance standards. For the purpose of this webinar, because I believe, and I could very well be wrong, but I believe the audience we have today is an audience that may not be overly familiar with our performance standards. So rather than talk about new performance standards versus old performance standards, we're just going to talk about what's current. So we're not going to worry about what's old versus what's new. We're just going to talk about what applies now, which means all of those performance standards that they maintained and kept, as well as the new ones combined. So I'm trying not to have any confusion. So the first important thing to share is that every 5 years, Head Start and Early Head Start programs are required to perform a community needs assessment. This is a comprehensive assessment that is kind of like a snapshot of your community and its demographics, as well as the programs and services that are available to families that are eligible for Head Start and Early Head Start services. So that assessment must include the number of eligible infants, toddlers, and preschool-age children and expectant mothers, including their geographic location, their race, ethnicity, and languages they speak. It has to include the number of children experiencing homelessness based on the McKinney-Vento Local Education Agency liaisons, the number of children in foster care, the number of children with disabilities, including what types of disabilities and what relevant services and resources are provided to them in the community, the educational, health, and nutrition and social service needs of eligible children and their families, including prevalent social or economic factors that improve their well-being, typical work, school, and training schedules of parents with eligible children, other child development, child care centers, and family child care programs that serve eligible children, including home visiting, publicly funded state and local preschools, and then the approximate number of children that they serve. Resources that are available in the community to address the needs of these eligible children and families, and then strengths of the community. And it's very important for me to really kind of go through the details of what's included in that community assessment, because I think it's a very valuable tool, not just for those Head Start and Early Head Start programs that do that community assessment every 5 years, but for those of you that are in the same local communities, you can access that. You can pick the phone up and reach out to your Head Start and Early Head Start programs serving in your communities and ask them to share that information with you and work together with them to really help understand the population that the two of you would co-serve. And we're going to talk a lot more about strategies to work together, but that's a really important tool that folks in the community can access. So also in the performance standards, children are considered what we call categorically eligible for Head Start and Early Head Start, again, based on McKinney-Vento. And this means that they don't need to prove their income. If they're homeless and they can show that they're homeless, then they're automatically eligible. They do not have to provide any income documentation. And in terms of, and I say this with air quotes, proving that they're homeless, really all they ask for is an agency maybe that they're working with to provide some documentation stating that this family is homeless. If they can't do that, or if they don't have that, then really the family just has to sign a statement saying that we are currently homeless. And if they have somebody that can verify that, terrific. If not, that's okay too. Head Start and Early Head Start are not going to demand that they receive some sort of proof. Okay, Joyce.
Yes.
I'm getting a message saying a network could not be. Are you seeing that?
Nope.
I'm afraid I'm going to lose it. If I lose it, I'm going to have to come back in. because I don't think
Okay.
it will let me forward.
Oh, you want me to forward the screen?
Yes, because
There you go.
mine didn't forward. I may have to exit out and come back in because I'm frozen.
Do you have it in a hard copy? And
I do.
Can you present without looking at it on the screen? Because I can advance the slides here.
Yes, I can, actually. I sure can, yep.
Perfect. So just let me know when you're ready to go to the next slide.
Okay, sounds good, thanks. And I am ready to go to the next. Oh, actually, no, I'm sorry. Let me just remember one. No, go ahead and go to the next slide, and it should say the first bullet is Head Start, early Head Start programs may reserve up to 3%.
You're good to go.
Okay, thank you. Okay, sorry about that, everyone. There's always a glitch, I guess, right? So in Head Start and Early Head Start, and now they are able to reserve a total of 3% of their slots specifically to hold on to them for homeless and foster care children that may present themselves. And the reason they're doing this is that if they hold these slots, it will prevent those children from having to be added to the wait list, and hopefully they'll be able to immediately begin receiving services. So if a program determines from their community assessment that they've done that there are a number of families in their community experiencing homelessness or foster children that could benefit from immediate services, then they can do this reservation of slots. Head Start and Early Head Start programs must provide a grace period for homeless families to meet the immunization requirements, and they also must assist them in getting those immunizations. So children who are homeless are able to attend Head Start for up to 90 days or as long as is allowed under state licensing, whichever is lengthier. They're allowed to stay maintain their slot in that program and attend while they're working to get caught up with their immunizations. And then if a family is not caught up, then the Head Start program must do everything they can to assist them, and that includes finding them a medical home if they don't have one, or a provider, and then transporting them if possible, or making arrangements for transportation for that family to get to the provider to see to that their children are up to date with their immunization. Okay, Head Start and Early Head Start programs must establish collaborative relationships and partnerships with local liaison and homeless service providers. And we're going to talk more about what that looks like and different ideas that I could share with you about working locally with your Head Start program. So next slide, Joyce. Recruitment of children. So the goal in this piece of the performance standards is to serve the most vulnerable children first. So basically they're telling programs that based on their community assessment, they should have learned what are your most vulnerable populations. You know, do you have a population of homeless families? Do you have a population of foster children? And seek them out. It's basically saying you need to actively seek them out because that should be who you're targeting first. Also children with disabilities. And then programs are allowed to individualize their services based on their community needs. They have a lot of flexibility to determine what exactly are your vulnerable populations. Some, for example, rural communities look very different than an urban setting. Some communities, for one reason or another, may not have much of a homeless population, where others may have a very high homeless population, so they're able to set their selection criteria and prioritize and recruit based on the individual sort of picture in that community. Next slide, Joyce. All right, the next section of performance standards that really focuses or speaks to serving homeless families is the selection process. So the goal in this area is to strengthen those requirements for the selection process and procedures. Head Start programs are required to have this, what we call a selection criteria. And basically what that is it's a point system based on the needs in your community. So for example, obviously a family that is homeless would receive more points, which would help carry them to the top of that wait list. Maybe in your community you have a high population of teen mothers or expectant teenagers. So that expectant teenager may also, or teen mother may also get a higher amount of points for that one factor. Other factors that may get higher points would be a child in foster care, a child with a disability, maybe a single parent family, a family where there may be domestic violence or substance abuse or alcoholism, maybe a child who comes from a family with one parent in jail or prison. So as you can hear, there are really a number of different factors that can be weighed heavily to make sure that those children at the most risk are sort of are sent up to the top of that waiting list. And certainly homeless children are one that we want to be prioritized at the top. Next slide, please, Joyce. Okay, the next section and final section of the performance standards that we'll talk about is attendance. There is a new focus on promoting regular attendance. Now, Head Start has always promoted attendance, but it has always been based more on a classroom. For example, they've always expected the classroom to have an 85% attendance rate overall. Now Head Start is starting to focus a little bit more on the individual attendance of each child because we know, based on research, that the huge benefits of regular attendance for child development outcomes in a child. So now we're not just going to look at the overall attendance of a classroom, but we're also going to track the attendance of each child. And when that child's attendance is low or intermittent, then the staff is charged with finding out why. You know, what's going on in that family and how can we help them to make sure that their child is able to get to school more regularly. And specifically in the performance standards, they really want folks in Head Start programs to emphasize the attendance of these special populations being children in foster care and homeless children. Something else that's required is that Head Start programs must have a system in place for ensuring that when a child is absent without explanation, that child is safe. So per the performance standards, after 1 hour goes by with the child not showing up for school, once that hour is up, then a program must make an attempt to contact that family to see why the child isn't in school. And an attempt really can be a phone call, a text message, any way to reach out and try to find out from the family. First of all, make sure that child is safe, and then document why that child isn't in school. And then that just helps, again, to try to promote that regular attendance. And if there are barriers for some reason to that child getting to school every day, to the Head Start program, then the staff of that Head Start program are to do whatever they can to help remove those barriers and see to it that child is able to come to school regularly. Okay, next slide, Joyce. All right, so the newest program model is this Early Head Start Child Care Partnership model. We are just programs are between 1.5 years to 2 years of having the implementation of their programs. The goal for this program is to expand the number and the quality of early learning opportunities for infants and toddlers. However, the goal was not to start brand new programs. it was to take children that are being served in child care centers and move them, or basically layer on top of those children in those child care programs the early Head Start performance standards. So early Head Start programs are partnering with child care. The child care are still serving the same children that they have in the past in the same classrooms. Maybe those classrooms have had some improvements made to them with Head Start dollars, but basically they're serving the same kiddos, but those services that they're getting are being improved greatly because they're getting those comprehensive services. They're getting a research-based curriculum. They're getting qualified 4-year degree staff in their classrooms, and many of the other benefits that the federal funding that goes into early Head Start can provide for them that a child care program normally does not have access to those funds. And this program model actually targets working families that are receiving child care subsidy and still meet those Head Start and early Head Start financial income guidelines. So it's a very specific population that this particular program has set out to reach. And then there's a new round of early Head Start child care partnership grants and expansion grants that will be announced in 2017 coming up here soon. Next slide, please, Joyce. Okay, next I'd like to review with you the policy statement on meeting the needs of families with young children experiencing and at risk of homelessness. This is a joint policy through the Department of Health and Human Services, Department of HUD, and Department of Education. The picture here is the same photo. I kind of took that right from the front of the policy statement, so you'll recognize it when you see it. It's available online, and I'll show you how to access the joint policy statement in case you haven't at the end of the PowerPoint. Next slide, Joyce. So the purpose of this policy statement, which, by the way, is rather lengthy, is to provide recommendations on ways in which early childhood, such as Head Start and Early Head Start, among other early Head Start programs, and housing providers, both at the state and local level, can collaborate to provide safe, stable, and nurturing environments for pregnant women and families with young children who are either experiencing homelessness or are at risk of homelessness. Next slide, please. And I put this quote in here directly out of the policy statement because for me it says everything about why we are here today together and why we're collaborating between early childhood programs, not just Head Start, and yourselves that serve the homeless and at risk of homelessness populations. And I'll just read it briefly. Recent data indicate that among persons who seek shelter because they are homeless in the U.S., the age group most likely to experience homelessness includes newborns or infants in their first year of life, and they are next the most likely to experience homelessness at ages 1 through 5. So that's really bringing together our population, and when I say our, I mean Head Start and Early Head Start, as well as all of the early childhood ed programs in Pennsylvania, and your population, meaning all of those of you that serve folks that are either homeless or close to becoming homeless or at risk of becoming homeless. Next slide, Joyce. Excuse me. So in this policy statement, they lay out 3 major recommendations, and they are to support a 2-generation approach to meet the needs of parents, both parents and children experiencing homelessness, to enhance the integration of early childhood programs and systems with local homeless assistance systems coordinated entry process, and to improve leverage and share data on early childhood homelessness. Next slide, Joyce. Okay, so what I'd like to do now is we'll go through each one of these 3 recommendations. And in each one, I'm just going to talk about some of the approaches that we can take, we meaning the Head Start and Early Head Start population, as well as all of you in the housing community, approaches that we can take together to try to collaborate locally to strengthen the services that we provide to folks. So first, the two-generation approach. This slide is just speaking to what we as Head Start and Early Head Start programs can do. So first and foremost, we can become informed and seek information about McKinney-Vento and the local housing community. So Head Start programs, I believe, should learn what the McKinney-Vento definition is. Learn all about it. Make sure that you're able to define homelessness for the families and children that you serve. What providers are in your service area? What is their mission? What services do they offer? How many do they serve? Who is eligible? Do they have a waiting list? And then when the Head Start and Early Head Start programs are conducting that community assessment, they should be reaching out to the local housing community because you are the experts in this area. And certainly you would be able to provide Head Start and Early Head Start programs with a wealth of information and data and trends, et cetera, that they can use in their community assessment. Again, by providing all of those comprehensive services that I talked about that Head Start and Early Head Start programs provide, that helps them to really learn about the needs of families and their circumstances, and then link them to all those available resources in the community, such as those of you that are working in the housing community. And then finally, afterwards, they follow up with those families to be sure that they are, in fact, receiving those services. And if not, why? And what can we do to help you link to either better link to that service or find someone else? And this work, most Head Start programs have family service workers. So these family service workers have a caseload of families whose children are enrolled in Head Start or Early Head Start, and they are the ones that are working with those families to develop their family partnership agreements, to help them set goals, to link them to all the resources in the community, to help them meet their goals and achieve the outcomes that they desire. And then another thing Head Start and Early Head Start programs can do is reach out to their housing community locally and offer to provide them trainings or do joint trainings with them on topics. There's a number of topics that they could do training on, such as child development, health, nutrition, etc. Another opportunity would be to do joint trainings. If there are areas the Head Start program has identified as a need for professional development or additional information about, and that's a need that they share with the housing community, then maybe they put something together jointly, and if there's a cost to it, they could pool their resources. That's just a few suggestions. Now, in terms of the two-generational approach, what can the housing community do? Well, you can seek out your local Head Start and Early Head Start programs and become, I'm sorry, Joyce, I didn't tell you to change slide. The slide should read number 1, two-generational approach, housing.
We're good.
Okay.
You're good.
Thanks. So the housing community can seek out the local Head Start and Early Head Start programs and become informed about what services they provide. So again, how many do they serve? Do they have a wait list? What areas do they serve? What are their demographics? Ask them to see data, learn as much as you can about their services and what they do in the community. And then as a housing community, provide those Head Start and Early Head Start programs with education and resources. Specifically, how do you screen for housing needs? And how do you properly identify homeless families? And share with them resources or tools or any information to help their workers become more skilled at performing these sort of assessments or screenings on families to determine their housing status. And then provide training and opportunities to Head Start and Early Head Start on your available services and your resources, eligibility, how to connect families to these resources, where you're located, maybe invite them to some of your meetings, and invite them to do a tour of your shelter, maybe invite them to sit on one of your boards, whatever it takes to get the two families of services, meaning housing and early childhood ed, together at the same table. And then if you're not familiar, if you have a shelter, utilize that early childhood self-assessment tool for family shelters. And I had intended to really get into a little bit more detail about this, but I'm not going to just because of timing. I want to be able to get through this and leave plenty of time for questions. But the self-assessment tool for family shelters is online, and I'll show you briefly where you can find that as we go through the slides. So next slide, Joyce. Okay, and Joe, if you want to jump in on this slide at all, feel free to, because this is certainly not my expertise. But number two is the number two recommendation is the coordinated entry. So collectively, what can we as a Head Start population and the housing population do together to improve this coordinated entry? So certainly, again, get involved with each other and develop a really comprehensive knowledge of all of your community resources. Implement a phased screening and assessment with an understanding of both the requirements of the Head Start and Early Head Start programs as well as housing, because we each have our own requirements in terms of screenings and assessments. You may have screenings and assessments in order to begin to receive services, and then once you are enrolled, you may also have screening and assessments that are due within a certain time frame. So get on the same page so that you each understand, maybe even build a timeline for folks. So if you're going to come into the housing as well as a Head Start program, what are all those screening and assessment requirements that are due, and what is the time frame? Engage in the prioritization process, again, with an understanding of both the prioritization under the housing community as well as the prioritization under the early childhood community. And then develop a two-way referral process. And oftentimes, this two-way referral process is something that can be a very detailed process that has policies and procedures and guidelines attached to it. And these are things that really there's no blanket answer for because there's a certain level of individualization that takes place in each community for both the housing community as well as early childhood. It really is a manner of developing these locally amongst the two entities. Next slide, Joyce. So the third recommendation is to improve, leverage, and integrate early childhood homelessness data. And in order to do this, they recommend that you set very clear goals together to determine what data and information each entity will collect in order to track collective outcomes. So come together, housing and early childhood, and spell all of this out ahead of time. Then start collecting your data, of course, while ensuring that all of the applicable privacy laws are met. Use that data then, after it's been collected and analyzed, for messaging and program and system improvement. So messaging to your staff, to your board, to your community, and to funders. This is a way to say to your staff, wow, you're doing great work, but we have a long way to go. To your board, it's a way to show your outcomes and your achievements, as well as we've done great we still have a long way to go. And, of course, that moves into your community and funders to be able to say, once again, we've met a lot of goals, we've achieved things, we've met some outcomes, but in order to keep doing this or to improve our services, of course, we're going to need some more funding. So you use all that data to sort of create your plan and back it up. And then the other thing is to share data amongst entities so that you can see the needs of families more holistically from a more broad perspective, so that together you can look for trends in your families and the populations that you're serving, and to look at the unmet needs in certain populations, and then strategize together how can you better meet those needs and serve those populations. Next slide, Joyce. Okay, I'm going to go through these very quickly, again, due to time. So there are, we're going to talk about national resources. The policy statement that I mentioned is the most comprehensive set of resources for those serving early childhood homeless families that there is out there. There are 12 pages total at the end of the policy statement of nothing but resources, and each of them are embedded. So if you download that policy statement and you go through that appendix, it'll take you 6 months to get through all the different resources, but there's a link to each one of them. So it's a wonderful document to keep right on your desktop. I do. And if you need to go somewhere, it's very quick and easy to access. So in this PowerPoint, I won't read them, but these are just all the areas of resources that are in that policy statement in the back in the appendix. Next slide, Joyce. There is the the Early Childhood Learning and Knowledge Center. We call it ECLIC. The website is there on the PowerPoint slide for you. When you open this page, if you go to the tab at the top, you'll see it there, TA Resources, and click on that. It opens what I refer to as the Pinterest of early childhood resources. In fact, it's one of those sites where I always say, like, if you're in Pinterest and you're looking for an idea for a color to put on your kitchen wall, the next thing you know, you're looking at tapestries for your basement, and then it's like, look at this shiny object, there's something I can do in my kitchen. You're all over the place because sometimes it gets a bit overwhelming. That's how eClick is. The number of resources, it is staggering. And they've done a really good job recently of sort of restructuring the website so that it's much easier to find things, and they're really organized nicely. So I very highly encourage you to save this in your favorites and refer to it for a number of good resources. Next slide, Joyce. Very quickly, if you are working at the local level and you're interested in finding who are the Head Start or early Head Start programs in my community or in my county, this is the website to go to. It's the Pennsylvania Head Start Association. If you open up their website, you see the picture on the left. In the upper right-hand corner, there's a little circle that has a county-wide map of Pennsylvania. Click on that, and it will open up to this picture on the right, which is just a map of PA broken into county. And if you just click on any one of those counties, it will open up to a page that lists all of the Head Start and or early Head Start programs that provide services in that county, along with their service area, their contact information for the director, phone number, email, the address, the number of children they serve, whether they're Head Start, early Head Start, state supplemental Head Start, or pre-K. And they just have a wealth of information about what's going on in Pennsylvania in Head Start and early Head Start and early learning. They're an advocacy association with due paying members. They advocate on the behalf of Head Start and Early Head Start, as well as all of early learning. So that's a great website. Next page, Joyce. This is just a list. I'm not going to read it, of all the different things that Pennsylvania Head Start Association offers. I highly recommend that you go to their page and join their listserv or their email list and receive their emails. And they also have a great comprehensive newsletter. So if you're ever interested in advertising something or announcing something that's statewide that you'd like to get out to all the Head Start programs and early Head Start programs in the state, I highly recommend that you do that through their Pennsylvania Head Start Association newsletter, and you can access that through me. Okay, the Pennsylvania Key is basically, I call it an arm of the Office of Child Development and Early Learning at the state, or OCDEL. They provide statewide leadership in the development of integrated and coordinated system of quality improvements and professional development throughout the whole entire state. This is where my office is housed. It's PA Key in Pennsylvania. I encourage you to explore their website, and I also encourage you to sign up for the Early Education newsletter, as it provides a wealth of information about early learning in the state. I'm not going to go through the programs and services. It's there for you. And then finally, we will get to questions and comments.
Tracy, this is Joe. Can you hear me?
I sure can, Joe.
Oh, great. Wasn't quite sure if I was unmuted. Thank you. That's awesome. Just awesome. There's some new resources in there that I've never heard about, and for folks on the call, and we have more than 100 people on the call, we'll make sure you get the PowerPoint, and in future emails, I think Joyce and I will talk about maybe specific things sending out to this group, particularly the policy recommendations that you cited. Some good things in there, particularly for folks who are in the COC and doing coordinated entry work. It's a great opportunity to bring this work in there.
We do have a couple
Joyce, do you want to manage the Q&A?
Yep. It looks like, Joe, we do have a couple of questions. One is, can you hear me? I'm on mute,
yes.
right? Okay, great. Yep. Is the community needs assessment every 5 years only for the homeless, or is it an overall community needs assessment?
It's overall. So it's a very comprehensive overall assessment of their service area. So for example, when I was the director here, our service area was all of Venango County. So I would assess the county in terms of eligible children and families for early Head Start and Head Start, keeping in mind that Head Start and early Head Start serve what we call the neediest of the needy families. So that is also probably a population that is most likely to be in the category of at risk of homelessness. So while it's not specific to homelessness, it certainly encompasses that population that would be most at risk of being homeless, if not already homeless.
And then, thank you. If a family is doubled up with a family or friend, is a letter from that family member appropriate enough?
Yes. There is no firm federal regulation to define that. It just says the program really needs to just document that the steps they've taken to document that this family is homeless, and if that's where they end up is with that statement, then that's perfectly fine.
Okay, and then I'm not totally sure, and Benita, if you want to unmute, it's *7. We have an additional question. How is the new initiative in Philadelphia to fill 2,000 pre-K slots coordinated to homelessness, or is this initiative something different?
You know what? I really can't answer that question for you. I can get the answer for you. The new initiative with pre-K in Philadelphia is not something that I've been really involved with because as much as some of the scope of my work may sort of roll out into a little bit of just having knowledge around pre-K. Really, I focus on Head Start and early Head Start. So I'd be happy to get the answers for that. I don't believe that it's devoted to homeless or at risk of homeless. However, I would be curious to see what, if anything, in terms of reaching out to homeless families they have. So I can look into that and get the answer to Joyce.
We do have a couple more minutes. If anyone has a question or a comment, we will be sending out the PowerPoint. To ask the question, do *7. Anybody have any additional questions?
Let me just say before we end, and while we're waiting for questions, my email address is in the PowerPoint, and I welcome any of you who have questions, comments, would like to do some follow-up work, anything I can do to assist you. You're more than welcome to email me anytime. And even if you have questions about early childhood that's not Head Start or early Head Start, maybe it's pre-K or child care, feel free to reach out to me, because I can link you to the people that have that expertise. So please don't ever hesitate.
Thank you so much.
You're very welcome.
Hello?
Yes?
Hi, this is Benita. How are you?
Good, Benita. Do
Great.
you have a follow-up question?
Well, actually, I wanted to find out if the terminology Head Start and pre-Head Start different than pre-K and kindergarten?
Yes, it is. Yes,
Can
it
you
is.
explain
Head
what the
Start,
difference is?
Head Start and early Head Start are specifically only to serve low-income children. So in pre-K and kindergarten, well, first of all, kindergarten is more school district, public school. Pre-K is not just for low-income children, and the income requirements are much higher. So Head Start and early Head Start are comprehensive programs, while pre-K is not, and they are focused on serving low-income families, and only low-income families. Does that help?
Benita?
Yes.
Great.
Very much so. Thank you.
Well, we are
Great.
at 2 o'clock, and again, the screen up has Tracy's contact information. We really
Joyce,
appreciate
with my email, does it say at PA Keys?
it. Does.
Great, because they just changed our email addresses last night, and I wanted to make sure I had the right one on there.
It says TRADUA@pakeys.org.
Perfect. Yes, that's
Great.
right.
Well, thank you so much, you and Joe, for bringing this issue to us, and hope everyone has a great weekend. Thank you.
Thank you so much. I appreciate it.
Thank you, Tracy.